Hello, my name is Laura, and today we are going to discuss the differences between Hypermobility Spectrum Disorders, or HSD, and Hypermobile Ehlers Danlos Syndrome, or hEDS. Let's first look at HSD. Hypermobility spectrum disorders are connective tissue disorders that cause joint hypermobility, instability, injury, and pain. Other problems such as fatigue, headaches, GI problems, and autonomic dysfunction are often seen in conjunction with HSD. Being hypermobile isn't necessarily a bad thing. In fact, many dancers and gymnasts are hypermobile. The problem occurs when joints are not just hypermobile, but are also unstable. Joint instability occurs when the bones of a joint aren't held in place securely. This can lead to joint subluxations, dislocations, sprains, and other joint injuries. Joint instability can cause both acute and chronic pain and can interfere with daily life. The hypermobility spectrum disorders occur when a person has symptomatic joint hypermobility that cannot be explained by other conditions, such as any of the Ehlers Danlos syndromes, Marfan syndrome, or lupus, etc. You may have noticed that the hypermobility spectrum disorders is plural, and that's because there are 4 types of HSD. The 4 types of HSD include generalized, peripheral, localized, and historical HSD. A person with generalized HSD will have joint hypermobility throughout their body. A person with peripheral HSD will have joint hypermobility that is limited to just the hands and/or feet. A person with localized HSD will have joint hypermobility that is limited to a single joint or a group of joints in the same area. And a person with historical HSD has a history of generalized joint hypermobility, but no longer does at present day. So what's the difference between HSD and hEDS? hEDS is a genetic connective tissue disorder characterized by generalized joint hypermobility, joint instability, chronic pain, and is associated with many comorbidities, including fatigue, headaches, GI problems, and autonomic dysfunction. Sounds quite similar to the definition of HSD, right? Honestly, there are more similarities than differences between the two disorders. Since currently no definitive diagnostic tests exist for either, they are both diagnosed clinically through physical examination and medical history. The treatment for both conditions is also the same, which is to manage the symptoms of the condition through physical therapy, medication, and pain management. In fact, many experts believe that HSD and hEDS are the exact same condition. The main difference between HSD and hEDS is not so much in the symptoms, but in the diagnostic criteria itself. The criteria for HSD is simply evidence of joint hypermobility in any form, and then evidence of that joint hypermobility causing problems such as joint pain, joint damage, joint dysfunction, joint subluxations and/or dislocations, etc., that can't be explained by other conditions. The diagnostic criteria for hEDS is a lot more extensive and includes evidence of generalized joint hypermobility, as well as evidence of connective tissue fragility, such as soft and/or mildly stretchy skin, hernias, prolapses, atrophic scarring, arachnodactyly, aortic root dilation, etc. I'll link a video somewhere on this screen where I go in more depth on the hEDS diagnostic criteria because it really is quite extensive. Since HSD and hEDS share many of the same symptoms and comorbidities, an HSD diagnosis is often given when an individual is being evaluated for hEDS but doesn't quite meet the strict diagnostic criteria. The hEDS diagnostic criteria was made so strict to aid in the search for the genes that cause the disorder by weeding out patients who might not have hEDS. Having an HSD diagnosis instead of an hEDS diagnosis, however, doesn't necessarily mean that your condition is any less severe than a person with an hEDS diagnosis. For example, I myself have hEDS, but overall I would describe my symptoms as mild. I haven't had a full dislocation in about 10 years. I typically only experience subluxations a few times a week, and my non-joint related symptoms are well controlled with medication. I lead a pretty normal life. A person with HSD could be having full dislocations on a daily basis and have severe GI dysmotility as well as disabling autonomic dysfunction. It truly is a spectrum disorder. So there you have it. You now know the difference between HSD and hEDS. Do you have an HSD diagnosis? How were you diagnosed and what are your symptoms? Let me know down in the comment section below. If you would like to support this channel, the best way is to simply like, subscribe, comment, and share my videos. As always, thanks for watching and see you next time.